I've been called worse. Thank you for allowing me to speak today. I'm Dr. Nguyen, Don Nguyen. I'm a private practice practitioner in Dayton, and I apologize for the outfit because I came straight from surgery. To quote a 5-year-old patient of mine, drinking water with lead is very, very bad for the brain. Well, the Medicaid Waiver 1115 is really, really bad for Ohio. It's not just more skin in the game, you hear that all the time, but this is skin, flesh, bone, and much, much more. The unhealthy Ohio plan calls for monthly premiums, additional copays, all of the wonderful things that you heard about today, but therefore already down and out, hardworking Medicaid patients, and they require this multi-layer bureaucracy of this elaborate debit card swiping and tracking, which is ridiculous in my book. It's complicated and it's going to be much, much costly. It is a prescription for disaster for up to 130,000 Ohioans, estimated to be kicked out and denied access to care. At a time when doctors and healthcare providers, healthcare systems are trying to achieve the triple aim of better outcome, of a more affordable and higher quality care, this plan will do the opposite. We hear about the death rate, infant mortality in the southwestern Ohio. We are ranked, what, 48, 49, 50th?
Almost.
And if we have this waiver, we will be off the chart, but even worse. Can you go worse than 50? We can if we apply this. So it's an experiment doomed to failure. We already saw that. When Oregon tried a premium program, 80,000 patients dropped off instantaneously. The same thing happened in Wisconsin, my Badger state. When Arkansas tried the so-called skin in the game plan, as you call it, it was so costly that it abandoned it. When Virginia tried the same thing, they found out that it spent $1.39 for every dollar premium collected. It's crazy. And then 4,000 children were going to be dropped out. And so the program now is dead. So when you compare it to the Indiana plan, which is always the program that they talked about, this program is much more severe because, like I heard today, is that it applies to very, very low percentage of the federal poverty level. And then when you drop them off, you have to re-enroll, but if you cannot re-enroll, then you're off, you're on the street. So where are you going to go? Emergency rooms, where the efficiency and the cost is so stupid to take care of patients in the emergency room. And you know what happened to that particular presidential candidate that mentioned that we could always send our patients to the emergency room?
Right.
You know what happened in 2020, wherever, 2012? So at a time when doctors are beginning to address and understand the so-called social determinants that affect so negatively the delivery healthcare system, this program will take us back to the pre-Affordable Care Act time period. The Affordable Care Act achieved expansion of care. This program, this unhealthy Ohio program, will do the opposite. Locking out patients means that you're going to have chronic care, chronic diseases are going to be interrupted for mental health. Suddenly now you don't qualify anymore. What do? You stop going to see your doctor, and then what's going to happen to your disease? It keeps on going. So we talked about infant mortality. It is so crucial because my patients, some of the parents, they just cannot afford the most basic necessities, the rent and the utilities, and you're asking them to spend more skin in the game, more bone, more flesh. That's not very, very good. So I think that as a physician, I'm going to beg you that you shelve this plan because you just cannot keep kicking these Medicaid patients around. And if I'm really sinister, I would say that this plan is to achieve that. And all of this talk about the presenter is no longer here, but I like to address her. I said, this is gobbledygook. And I have a degree in math and statistics, with a major in statistics. And all of these words, deductible, copays, rollover, whatever, it's all a facade.
That's right.
The deductible thing is a fake. They admitted it. Because it's money that the state is going to pay anyways, and then it's not a change of hands. The co-pays are going to be additional, and you cannot allow ask these individuals that are already down and out to even pay the $5 or $8 or $10 or whatever co-pay. So this preventative care kind of a business that you're talking about, I like to ask these people whether they are going to commit themselves to have better health care for themselves, better preventative care for you. And here you're asking these people that are thinking about where to find the food the next day, where they're going to get the bus pass for the next day, to buy into this idea of better exercise, better food, or whatever. It is the craziest idea. And well, it's not that crazy, because if you think that you are going to drop these patients because you're going to adopt this waiver, or you're going to hope that CMS will give it to you, it's not so crazy, because you know half of the states or close to it are still not expanding Medicaid, because these individuals want to punish these poor working people, despite knowing that the money is there, that the health care, the system saves lives and saves money, saves hospital systems because of their uncompensated care has been reduced in those states who adopted Medicaid expansion. So to me, this is a no-brainer. Just stop kicking those Medicaid patients around, because you are not fooling anyone. You're not pulling any wool over anybody's eyes with this deductible, preventative care, rollover, core, no core, baloney. Thank you.